Can you go to the next slide? Yeah, thank you for introducing me. And I would like to thank the organizers for giving me this opportunity to make the presentation. It's going to be a very short presentation. So basically, I'll be talking about what we do in Bhutan with regard to cervical cancer screening and prevention activities. So I would like to start by conveying greetings from the King of Bhutan, His Majesty the King of Bhutan, and people of Bhutan to all the audiences out there today. Next slide, please. And I would like to start with the introduction of Bhutan. I'm sure many of you do not know where Bhutan is. So Bhutan is a small landlocked country which is located in the Eastern Himalayas in between two big countries in Asia, surrounded by China in the north, India in the east, south and west, and we have a population of about 700,000 only. Next. And in Bhutan, the basic healthcare system is free of charges, including the ambulance. We have two types of ambulances, the vehicle type and other one is helicopter ambulance. So the people have choice, and in case of emergency, they can use it for free. Next. In Bhutan, as per the cancer registry of 2019 to 2022, cervical cancer was the most common cancer among female, with the crude incidence of around 18.9%, and the ovarian cancer, which is both gynecological cancer, it is the 5th leading cause of cancer in Bhutan. Next. And to give us brief breakdown of cervical cancer cases in Bhutan, from 2018 to 2022, there were around 344 cases, of which 298 received treatment with curative intention and 46 received treatment in the form of palliative care. So in Bhutan, we have limited manpower as well as limited resources. So some of our patients are referred outside to India for treatment, especially for radiation therapy. So in 2018 to 22, 115 patients were referred outside, which has caused to increase healthcare to the government of Bhutan. Next. And if you look at the timeline of cervical cancer prevention in Bhutan, the conventional pap smear was started in 2006 as a nationwide cancer screening program. And in 2010, the royal government of Bhutan has initiated HPV vaccination for girls. And in 2020, the HPV vaccination was extended to the boys as well. And we have started HPV DNA-based cervical cancer screening program in 2020 in the form of health flagship program. And by the end of 2023, Bhutan has achieved our target. And Bhutan got the recognition for this achievement from the World Health Organization. Next. And if you look at the vaccination, initially, the recommendation was 3 doses HPV vaccination, and slowly it moved to 2 doses. And now it is 1 dose for many of the countries. And if you go to Bhutan, next slide, if the experience from Bhutan is, if you look at the right slide, the vaccination coverage for boys, for the girls, it has been consistently above 90%. And from 2010 to 2015, we used 3 doses of HPV vaccination. And from 2016 onwards, it was 2 doses. And for boys, it was started in 2020, and the coverage has been consistently above 90%. Next. And from this year, our HPV vaccination is shifted to single dose, so that this is one way to sustain the vaccine coverage in the country. Next. And in Bhutan, we no more use conventional pap smear for HPV DNA testing. Since 2020, we have shifted to HPV DNA testing. And we test women between the age of 30 to 65 years every 5 yearly. And if the HPV is positive, we try with genotyping, limited genotyping, and HPV, if HPV 16 and 18 is positive, we do colposcopy, and other HPV types are positive, then we do reflex liquid-based cytology, and depending on the result, we base them either to colposcopy or follow up in 1 year. And if the HPV is negative, we follow up every 5 yearly. Next. And at the end of 2023, Bhutan has achieved 90-70-90 global strategies towards elimination of cervical cancer. And for this, the World Health Organization has recognized the Bhutan, and they have felicitated Bhutan for being the first country in the region for the success. Next. And in Bhutan, we have colposcopy, and colposcopy there we have 20 districts, and out of 20 districts, we have 9 centers of colposcopy. And in Bhutan, the colposcopists are usually the gynecologists who had some form of basic training on colposcopy and treatment of precancerous lesions of the cervix. Next. This is the pathway of referral for colposcopy in Bhutan. So I don't want to stress much. Next. Next, please. So the next question is, so what? Sustainability of quality services is our national target now, because we have already achieved the numbers, 90, 70, 90. So what are we going to do next? Next slide, please. And we conducted a small study in Bhutan, in the National Referral Hospital of Bhutan. And what we found is the performance of colposcopy in the detection of histologic CN2 was not up to the expectation. The sensitivity was just 66.67%, specificity was 72.73%, and accuracy was 72.24%. Next. And in Bhutan, in order to reach the remote area, we do a lot of colposcopy camps. So we conducted a small retrospective study where the sample size was very small. And in here also we found the accuracy of colposcopy to detect histologic CN2 plus was very low. It was 60.94%. All of these point towards the quality issues. Next. And in Bhutan, we have been performing LEAP in the operation theater setting under the general anesthesia. However, in the camp setting, we do under local anesthesia, and we analyzed this and found out that the local anesthesia is acceptable for Bhutanese setting, in the OPD setting, in the colposcopy camp setting. However, the surprising thing was the margin positivity for high-grade lesion for the LEAP specimen was found to be very high. It was 36.4%, which is a concern for us. Next. And next, please. Yeah. Can you go back, please? Sorry. So in another retrospective study, we tried to analyze the margin status of the LEAP specimen. And here also, if we include the unknown status of margin, positivity or negative, it was exactly like what we got in the previous study. It was 36.4%. Both of the small study points towards improvement of quality initiative in Bhutan. Next. So, what are the plans for National Cancer Control Program in Bhutan? So, our plan was to develop a practical guideline on colposcopy and treatment of cervical precancers in Bhutan. I would like to share how we did this, and then we plan to sensitize the relevant health professionals on national guideline. Then after this, we want to do regular monitoring of the activities and to do research to generate local evidences. Next. So after finding out all these lapses in colposcopy and lip services, we got together and we developed this guideline, which is meant for the colposcopist, for the colposcopy nurses, and for the scrub nurses. Next. So the development of this guideline is basically done by our own people. We did not depend on any external experts to come out with a guideline. So initially, the group of experts in colposcopy, we got together and we came up with a draft guideline. And next, and this guideline was shared to the experts, so within the country as well as outside. So basically, we did not get any comments from the reviewers, and only thing we got from our senior colposcopists is that we need to strengthen the monitoring aspects. Otherwise, we did not receive comments from our from the colleagues outside. Thank you. Next. And finally, after 3 months, we finalized this colposcopy guideline. And next. This guideline was not left like that because probably it is same in India as well. If we just develop the guideline, if we do not sensitize the relevant end users, it remains as a booklet or in the web page, and nobody is aware of this. So considering this, we conducted sensitization program for the end users in the batch wise. So this is the first batch. And in the picture, you will see one of our colposcopists performing lip, and I'm trying to supervise the lip procedure. And this was done to all the health workers in Bhutan. Next. Yeah, this is one of the picture from one of the centers where we conducted the sensitization program. Next. And when we assess the knowledge during the workshop, the mean score of the knowledge, pre-test and post-test, there were significant improvement in the knowledge score, which underscores the importance of continuing medical education. And we thought we have done a good job by doing the sensitization job. Next. So this is probably my last slide. So what are the way forwards? Number one is routine monitoring of the health workers paired with regular audits and research to evaluate the improvement. Conduct a nationwide multi-center study to assess the performance of colposcopy and outcome of lip and thermocoagulation, which would provide information on whether our efforts had any positive impact, identify barriers, and provide with the way forwards for improvement, which is suitable to the local context. Collaboration with regional and international partners to learn and adopt their best practices in our setting would improve the services. Introduction of artificial intelligence in colposcopy, which would help in improving the diagnostic accuracy and quality control standardization. And the revision of cervical cancer screening guideline in Bhutan. Maybe this will be done next year. So thank you so much.